Hi, my name is Bernice McKenzie. I am an audiologist and the owner of the Hearing Dizziness Clinic. We have locations in Amherstburg, Essex, LaSalle, and Windsor, but we only see dizzy patients at our Windsor location. This is a quick video. Why am I dizzy? I want to go over what we do at our clinic, something I would like patients who are coming to see us to watch before they book an appointment, just to make sure that they know what we do at our clinic and that we meet their expectations. So I'm going to go over how our balance system works, common causes of dizziness, the full assessment, why you should be assessed before you start any type of therapy, how does rehab therapy retrain your brain, and again, what we do at our clinic here in Windsor. Okay, so we have 3 different systems that contribute to us feeling dizzy. So our inner ear is what we test here. Our job is ears, okay? So in your inner ear, there's something called a cochlea. It's your system of balance. It's also your system of hearing. But that's why we're called the Hearing and Dizziness Clinic, because we're working on that one system, the cochlea. The cochlea keeps you upright. It senses gravity and movement. It sends a signal to your vestibular nerve, okay? But your brain is getting information from your vestibular nerve, from your eyes, so your visual system, and proprioception, which is kind of a fancy way of saying like the muscles and your body, okay? If anything is wrong, or if your brain misreads anything from any of those systems together, that's when you feel dizzy or imbalanced, or that spinning sensation, vertigo. So there are many causes to vertigo. Some are your ear, okay, and sometimes it's not your ear. We like for you to see your family doctor first if you're dizzy before you come see us, because we want them to make sure it's not a side effect of your medication. Something's not going on with your heart. Maybe you have something going on with your neck, okay? It could be anything, okay, that's going on. If they believe it's your ears, they will send you to us, okay? We have neurologists that send to us and ear, nose, and throat doctors who send to us. But we would rather you see your family doctor first before you book an appointment with us directly. Now, when it is your ear, there are many different causes. It could be BPPV. You might have heard of those little crystals in your ears that are out of place. Vestibular migraine, neuritis or labyrinthitis, or Meniere's disease. Those are the things that we're looking for in our clinic. We're not going to diagnose you. We're going to do testing to see what could be the cause. At the end of the day, you're going to go back to your family doctor to get your final diagnosis, or your ENT, or your neurologist. So BPPV is what we hear the most at our clinic. It's a benign condition, okay? Those little crystals in your ear is what most people hear, or ear rocks. Usually when you're seeing us, it's not BPPV. And BPPV is not the only type of dizziness. If it is those crystals, we do a special test. It's called the Epley maneuver, where we lay you down and we look at your eye movements to see, okay? We want to see a certain type of eye movement. Your eyes moving back and forward does not signal BPPV. Your eyes rotating, okay, will signal BPPV. BPPV usually lasts seconds. Sometimes they'll last up to a minute, but it's seconds, right? Up to 60 seconds. It's not something that's going to last an hour, 2 hours, 5 days. It's one thing, it's mechanical, it's something that we can treat here in our office, usually 1 or 2 treatments, and we've helped resolve the problem. Now, we have 3 different ones in each ear, okay, where the crystals can originate. The problem are a lot of patients are trying to self-treat, and when they self-treat, they move those crystals from that one canal to a different canal, which totally changes how we treat the situation. So if you suspect that you have BPPV, book an appointment to see an audiologist or a physiotherapist, or any type of therapist who's trained to work with BPPV patients. Don't go to YouTube and look up a video on how to treat it on your own, because you might make things worse. And it is, as I said, it's a benign condition, and you may make it much worse than what it needs to be. vestibular migraine, it's not a new condition, but a lot of people who we thought had Meniere's disease way back when really had vestibular migraine. So you're dizzy, but you're dizzy because of the migraine. I don't have a single test where I could put goggles on you and tell you that you have vestibular migraine. It's more of we go over all your test results and your case history. And it's more of, we go everything and it's none of these, and the only thing left could be vestibular migraine. In that case, we're going to recommend that you go back to your family doctor or your neurologist, because the way that you fix vestibular migraine is that you treat the migraine, right? You get rid of the migraine, you get rid of the dizziness. So vestibular migraine, a lot of people, usually females, might have this condition, but if you have migraine and you're dizzy, you might want to talk to your family doctor or your neurologist about it, because you may have vestibular migraine. Okay, then we have neuritis and labyrinthitis. So this is an inflammation of the nerve. In the case of labyrinthitis, you're dizzy and there's usually hearing loss or tinnitus. Whenever we see a patient, we start with a hearing test, because a lot of people come in and they'll say, nope, my hearing's normal. And then we do this test and we find this huge hearing loss that they did not know was there. It helps us differentiate between different conditions, right? And then when we send you back to your family doctor, it helps them give you that diagnosis that you need. So for this, we usually do testing where we put goggles on you. I'm going to talk about it later, but it's most likely we would do a VNG on you to help. So with neuritis and labyrinthitis, the story I usually hear is a patient says, I woke up in the middle of the night and everything was spinning, or I felt like I was drunk, but I didn't drink anything. This is something that's going to last days or hours, but usually it's days to weeks, okay? And as I said, we do have testing to help identify if this could be the cause of your dizziness. The issue is a lot of people are told that they have BPPV and they're told to do exercises for BPPV, but that's not going to help if it's neuritis or labyrinthitis. So not all dizziness is the same, okay? BPPV, vestibular migraine, labyrinthitis, they're all different. Some last seconds, some last minutes, some last hours, some last days to weeks, okay? We do a hearing test because they have different patterns on the hearing test, and it helps with that diagnosis that your family doctor or ENT or neurologist is going to give you at the end of the day. And as I said, we always want you to see your family doctor before you book an appointment to see us, because sometimes it's your blood pressure, or you could be diabetic and it's your sugar, or you're taking more than 5 medications and those medications are interacting with one another. So we always start with case history. We're going to ask you a million questions. We want to know if this is something new. Has it been going on for years? Does it last a couple seconds, a couple hours? Does it last days? Does it last weeks? Is it something that your mom had, right? Is it, a family history of having the same thing going on? We want to test your hearing, as I said. We're going to do some vision testing just to see if your eyes are affected. We want to see if there's oscillopsia. So there's some computerized testing that we can do for that. We'll ask about medications. We have a nurse who's going to go over your medications with you just to see what could be causing your issues. Okay, so the biggest test that we do is called the VNG. Okay, we're going to put some computer goggles on you and we're going to see, are both ears working the same? First part of the test, you're going to be tracking a red dot. We're trying to see, is this something neurological or is it actually your ear? At the end, we're going to try to make you dizzy on purpose. What we're going to do is we're going to change the temperature in your ear. So we'll start with cold air, see how dizzy you get. So we'll see your eye movements. Then we'll do it again with warm air. We're going to compare the left ear to the right ear to see if they're balanced. If they're not balanced, then we know which ear is potentially the culprit. Then we have vHIT. So VNG was only testing one canal, but vHIT will test all 3 canals in your ear. So we have 6 in total, 3 on each side. Okay, so with vHIT, we're doing these head movements, okay, to test the canals. So what V&G was only getting the results for 2 canals, now we can do all 6 canals just to make sure which canal could be causing issues. It's a newer test. It wasn't around a long time ago, but science is always changing, so we have new tests that test different things. So vHIT is something that we do offer at our clinic. Then there's VEMP, where you put a sound in. So we have those canals, but we also have the saccule and the utricle. So 2 different types of VEMP. There's cervical and there's ocular VEMP. One's going to check the saccule, one's going to check the utricle. So our job is to test your entire cochlea to figure out if your ear is actually the reason why you're dizzy. And the testing matters. We want to know what part of your ear, and that's going to help when you go for therapy, because now they know what types of exercises you need to treat your specific condition. Now, as I said in vHIT, we're moving your head. Well, some patients can't move their head, okay? So if a patient's unable to do this, and you're not doing it yourself, we're doing it for you, we're adjusting your head and we're twisting it, we're going to recommend Rotary chair. We do not have Rotary chair at our clinic. It's something that your family doctor or your ENT would have to send you to London to get done. But it's going to give you some of the information that we would get on the V&G and the caloric test. And it tests both sides at the same time. But again, if we can't do any of our testing, it is something that we would recommend that you go and get done. Posturography is going to test your vision, your inner ear, and your proprioception, so body sense, all at the same time. It's a great test. Again, we don't have that here. I'm not sure if they have it in London, but it will test all those systems at the same time. And again, that will help you with a treatment plan. It's not always needed. We do have it's like a screener posturography test that we can do. We don't do it all the time. Sometimes I will do on older patients, but it's not the gold standard. The gold standard for posturography is an actual posturography machine. So assessment always comes first. If it is your ear, we want to know what part of your ear, which ear. If it's a canal, which canal. That's going to help your treatment plan. So when your therapist starts to develop a treatment plan for you, having that information is going to make the exercises that they prescribe to you, make sure that they're the correct ones, pretty much. And as I said, sometimes it's not even your ear. It could be your heart, it could be medications, something that's going on with your neck. It could be anxiety. BPPV is, someone had a vertigo attack years ago, but it was never resolved correctly. And then there's also neurological conditions that can make you dizzy. We want to make sure you go to the right provider, and sometimes that right provider is not us. We're here to see if it's your ear and which part of your ear. And once we have that information, then that will help with your treatment plan. Sometimes we have to use habituation, and we use it for dizzy patients and also tinnitus patients. So if you have ringing or buzzing in your ears, habituation is what we use for that too. So basically, you're exposed to what makes you feel dizzy, right? Until you don't feel it as much. So, I'm doing physio for my foot right now. I tore my Achilles. I'm moving my foot like this in order to get used to it and for my brain to ignore the pain and to strengthen it. So it's an exposure type thing. It's not really 100% accurate what I just described right there. It's not the exact same thing. But when you're dizzy, if turning your head to the right makes you feel dizzy, well, we're going to practice turning your head to the right and doing different things so that your brain stops feeling dizzy when you turn your head to the right. Now, this only works if it's certain conditions. Obviously, if you have BPPV, turning to your head to the right is not going to work because BPPV is a mechanical issue, and then for that, we have to mechanically fix it. But the rest, because there are issues that are arising from the brain, or the reason that you're dizzy is because of a signal that your brain is sending, we're going to retrain the brain. That's what we're doing. We're retraining the brain. As I said, your rehab should match your test results. If it's a gaze issue, we want to make sure those are the type of exercises that you're doing. As I said, if it's BPPV, we want to reposition you because that's a mechanical issue. If we need to teach you habituation exercises, everyone's different. Not every person who has vertigo has the exact same type of vertigo. It's not going to be the same reason you have vertigo. It might be different conditions completely. So a standard worksheet that you give every patient is not going to work. Every patient is different. Every patient needs a different treatment plan. And there is research behind this, of course. Dr. Gans, where I did my training, and most of my staff, I usually send them to see Dr. Gans do training there. He's been doing research on this forever. He works with astronauts from NASA. He knows what he's doing. We've had the guidelines for years on how to treat dizzy patients. So, yes, a one-page sheet protocol that you give every patient is not the correct thing to do. Every patient is different, and the reason why we do the testing is to figure out what's wrong so we know what types of exercises or rehab we need to do with that patient. So at our clinic, what we start with a hearing test. We have you come in, make sure there's no hearing loss, and then obviously we want to make sure there's no wax in there, because when we're blowing that air in your ear, those ears need to be clean. We do testing. We do computerized testing. So you're going to be connected to a bunch of different computers so that we can measure and see what's going on. We use your eye movement to see what's going on with the testing, but everything's computerized and it's age normed, which is important. Patients over the age of 80, unfortunately, we don't have norms for you. If you come in, all I can say is that your system is normal. I can't really say it's abnormal because we don't have norms for anyone your age. So if you're over the age of 80, I recommend that you have your family doctor send you to London. They might have extra testing that they can do there. But because we don't have norms, we'd rather not charge you to do testing and then at the end of the day tell you we're not sure what's going on because we don't have norms for your age. Same thing, if someone can't move their head or their neck, again, we don't want you coming in because we don't have we're going to do testing that involves neck movement. So if you can't do that, we can't do our testing. So again, anything like that, let our staff know because we're going to recommend that you go somewhere else for testing. Because if you can't move your head or your neck, we can't do all the testing that we need to do to help us try to figure out what's going on. Okay, this was a little longer than I thought it would be. I thought it would be 10 minutes. But if you've watched this video and you do want to come in for testing, it is a couple hours of testing. So the first time you come in, you're going to be in for about an hour. The second time you come in, it's going to be 2 hours of testing. You're not covered by OHIP, so you would have to pay on your own and then submit. Some insurance plans will reimburse you, but not all, and we don't know which plans do and which plans do not reimburse you. As I said, it is also covered at the hospital in London. You would just need your family doctor to send a referral for you to go there. You can book an appointment online to see us at youhere.ca. There's a button where you can where you can book an appointment. But usually because our wait list is so long, we usually have you call the clinic to book those appointments. And then we'll move you up on the wait list if there's someone who cancels.